Hi, Dr. Ryan Coster here from Chiro Clinic Moncton. Today what I'd like to talk about in this video is a particular problem that I see very commonly in clinic, and that's known as coccyx pain or tailbone discomfort. And generally what happens is patients come into the clinic and they explain that they have pain right here without any major obvious mechanism of injury. And what they're generally pointing to is this tailbone here, the coccyx that you can see on this part of the spine here. This is particularly common in students and office workers who spend an awful long time sitting, generally in a crouched position like so. As soon as a patient who's a student studying at university perhaps, or an office worker who spends 8 hours a day sitting at a workstation, as soon as they lose that lumbar curve in their lower back and it rolls back like so, the tailbone has now made contact with the chair that I'm sitting on, and strain starts to happen to the surrounding musculature and ligaments and actually pushes that tailbone in a wrong direction. If I show you on this chair here, if this were a patient sitting sideways, this is the back of their skull here and they are facing this way, the curve in the lumbar spine should be nice and accentuated like so. That means that the shoulders are not rolling forward and the head's not going this way. When the patient slouches in the chair, basically they lose that curve, and as you can see now, the tailbone has now made contact with this portion of the chair, and strain begins. Pain then starts to happen. Once they go to get up after sitting in that position for a long time, they'll get up and say, oh geez, that really hurts in the tailbone there, and you'll get a sharp pain here, hard to kind of straighten up. And what we really need to do is get the pressure off the tailbone altogether. There's many different ways you can do that. We can certainly show patients many different techniques in the clinic itself. You may actually need treatment to the area on the side of the coccyx here with the muscular connections, and maybe even some movement through the sacroiliac joints and lower lumbar spine connections. There's many different things that can happen from purely putting too much pressure on the coccyx itself. If you find you're having too much problems, you can give us a call at the clinic on 852-3900. Otherwise, you can check out our website, chiroclinicmoncton.ca, and please go to our Chiro Clinic Moncton Facebook page and click like for future updates. Thanks and have a great day.